Welcome to Coffee with Kyle. Good morning. All this talk of language the past couple of days really got me reflecting and trying to think a little bit deeper about collaboration. And collaboration was a big theme at the Combined Sections meeting with some of the talks that I was involved in and some of the talks that I had the pleasure of attending. And I think good collaboration is predicated on everything that I kind of talked about yesterday with regards to language and productive disagreement and, of course, being able to interact in a way that's not threatening but rather productive. And one of the things as I was reflecting on collaboration is the fact that you have to look outward in order to collaborate. And what I mean by that is, you're not going to collaborate better, or we're not going to improve collaboration at an individual level or a profession level or between stakeholder groups by advocating specifically for ourselves or our profession. But collaboration is really going to come from understanding others and understanding all the stakeholders and the system that these stakeholders work within or practice within, because then you can identify gaps that your skill set or expertise can actually fill. And I think that's interesting because oftentimes we look at this as a space to fill, almost like a market space or an unsolved problem where we can go as an individual or a profession or a subspecialty and go fill that space. But sometimes it's subtle little things, like you notice one little thing about a patient case that from your lens as a physical therapist you can actually assist with. And so I think it can be grand and profound, where by understanding what everyone else does, understanding what their expertise and knowledge is, what they're comfortable with, how they're assessing and solving problems, you can actually identify big gaps, and then you can fill those gaps. But sometimes the subtle things are just as interesting. The PT's perspective on a little bit of positioning or a medication side effect or how someone is doing with a specific activity. I think those things can be helpful as well. So I think when we look at collaboration, we need to look more outward than inward. And one of the things one of my colleagues, Becca Medina, talked about in a presentation that we gave at CSM was kind of disciplinary models, working from intradisciplinary all the way to transdisciplinary. And there's a lot of different definitions out there if you want to kind of dive into some of the theoretical and practical frameworks of interdisciplinary or multidisciplinary or transdisciplinary care, but I wanted to read a few to you because I find them pretty interesting. So if we kind of scale from the bottom up, if we talk about intradisciplinary, we're talking about working within a single discipline. And this is unfortunately how most professionals are trained, right? We go to school together with PTs the majority of the time, even if we were lucky to be on a campus where we did have interdisciplinary classes. So it's kind of insularly or internally focused, I would say. Then there's cross-disciplinary, which is viewing one discipline from the perspective of another. So the example there is, okay, let me view kind of MD practice from the perspective of a physical therapist. And then if we move up, which is, I think, a buzzword term or a term people like to throw out all the time, is multidisciplinary. And this is when people from different disciplines are working together, but they're each really drawing on their own disciplinary knowledge. So the physical therapist is working with the nurse, is working with the respiratory therapist, is working with the physician, but they're all really only drawing on their own disciplinary knowledge or language or frameworks or perspectives. Then we move up to interdisciplinary, and that's when we actually start integrating knowledge and methods from different disciplines, and we're actually using a real synthesis of approaches. We're really trying to come together and say, okay, let me integrate this respiratory therapy knowledge into my physical therapist practice. Let me try to integrate this method from physician practice or physician research or whatever it may be. But there's one more kind of tier that I found very interesting when yesterday I was talking about exploring precision in language and kind of having good definitions. And it does always go back, I think, to that M-cubed mayhem triangle of mathematics, mathematical theory, and metaphor. But the definition that I found, or that we found, of transdisciplinary care was actually creating a unity of intellectual frameworks that transcends beyond disciplinary perspectives. And this one really gave me pause, because this, I think, is really hard, but this is also something that I think the more you focus internally the harder it becomes to actually achieve transdisciplinary care. Because in order to achieve transdisciplinary care, you kind of have to already have the foundation of interdisciplinary care, which means you have to integrate knowledge and methods from different disciplines. And then you have to come together to create a unity of intellectual framework. So this means that you have to have precision in language. It goes back to the example from yesterday that I always talk about, that if you get 100 physicists to define strength and 100 physical therapists, there might not be a bunch of congruence there. There might be good kind of intuitive, metaphorical explanations by the physical therapist, but the physicists are going to try to drill down to a unity of framework or language. And I think what this kind of opened my eyes to was that if we're looking to do transdisciplinary care, there's no protected knowledge. And what I mean by that is there's no one who is a knowledge gatekeeper. And if there is protected knowledge, if there is basically only multidisciplinary care, well, the physical therapist is the expert on physical therapy. The pharmacist is the expert on pharmacy. The physician is kind of, we could say, the general manager or the expert in physiology. But they're not trying to come together and create a unity of frameworks. There's protected spaces there. And when we have that protected knowledge, that precludes potentially challenging. That precludes actually what I was alluding to yesterday, which is productive disagreement. And that's not just people challenging MDs, that's people challenging anyone. So, well, that's the physical therapist. They kind of speak their own language, they do their own thing. They're the experts in rehabilitation or what have you. We're not going to challenge them. We'll just take the recommendations. And I think when we get to a transdisciplinary mindset, it forces us to be more disciplined with our language, and it forces us to collaborate. But again, collaboration absolutely requires precision in language. And an example I'm going to use that, my friends and colleagues Matt Shremba and Paul Maltowski of Canadas Athletics have really been vocally critical of is the human movement system. If we as a profession are going to define something without trying to create a unity of intellectual frameworks that goes beyond our discipline perspective of, we think we have an identity problem. We want to own something. We want to define something. If we don't go that route, we're making up language that's actually going to block collaboration. And I think that's a great example that, something that I've talked about before is, as physical therapists, we love to make up our own language and our own things. And I don't know if that is, an inferiority complex or an ability to try to, carve out a niche or whatever that may be. But I've found, or my experiences in the hospital kind of suggest to me that it's actually more powerful to take your lens outward and to try to the best of your ability, instead of advocating and always explaining physical therapy and hoping that someday in the far distant future, at the end of that bridge to nowhere, we'll walk into the hospital or walk into the clinic and the seas will part and there's the nurses and they say, there's the physical therapist. This is exactly what they do. Those guys are the best. Everyone knows exactly what you do. Let's be realistic. That's not going to happen today. It's probably not going to happen in 5 years. It's not going to happen in 10 years. Physical therapists are a small part of the healthcare system and the healthcare professionals. It's unrealistic, I think, to think that writ large everyone's going to understand what we do. Just like, do we really understand the nuance and the details of what an endocrinologist does, what a bone marrow transplant nurse does, what a medical ICU respiratory therapist does? Probably not. So I think we take a more grassroots approach to this problem, and instead of focusing on me, how will people understand us? We open our lens outward and we say, how can I understand this person's knowledge or this person's skill set? And then how can I work with them towards a goal or a problem that a patient has to illustrate my knowledge and expertise and educate them on the ground floor and make some change that way. Now, I will admit there are systemic problems with professions not understanding each other and collaborating, but I think we can solve these problems at the scale where we work or the scale where we practice by taking that outward lens, by trying to understand the language and the frameworks of nursing, the language and the frameworks of physicians, respiratory therapists, pharmacists, dietitians, you name it. And then we can fill all these spaces and maybe we can be part of unifying intellectual frameworks. But that takes scientific discipline and language use. And I think it takes probably a lot of humility. I mean, I think this is something that has, for sure, especially earlier in my career, was really hard for me as an empowered young physical therapist to say, wait a second, it's on me to take ownership to understand everyone else. It's not on them to understand me. And I think that was a transformative kind of mindset for me that gave me actually a lot more satisfaction, but it also kind of broadened my lens on what's possible when we do practice in a transdisciplinary manner. Because then it is true teamwork. We get to depth of knowledge. We share knowledge. We're always learning from each other, and we can better solve problems. Because at the end of the day, and I've talked to Sarah Hag and Sandy Hilton about this, is, physical therapists are more like surgeons than they care to admit. We really like to do things to people. And really, I think we want to take a step back. We don't want to get away from being interventionalists, but we want to broaden our lens to be problem solvers. And if we collaborate in a stronger manner, in a more unified manner, where we're using other people's language and learning from them, I think we can become vast problem solvers at the individual level where we practice, as well as at a grander scale within healthcare. So those are some of my thoughts and reflections this morning on interdisciplinary, transdisciplinary care and kind of collaboration and language. So hope everyone has a great weekend. For the people who want to know what coffee I'm drinking this morning, I haven't had it yet, but Kenny Veneer will be very happy to know that we'll be going to a nice kind of hipster coffee roastery this morning and getting a nice cup of coffee. So not at work today, so I'm yielding away from the $1.35 cafeteria specialty roast. So have a great day. It was good to see you.